Hello and welcome to It's Your Case, brought to you by VetCT.com. I'm Lucy Meehan, your radiologist on demand for this week. This week's case is our final equine takeover case. We've got a thorax for this week of a 4-year-old Warmblood with a cough of 3 weeks duration. Just to run you through the images quickly, you'll see from the images that we've got that it's not possible to get a horse's whole thorax on a plate at the same time, so we have to do a number of different views and sort of fit the puzzle pieces together. So in the top left corner here we've got the sort of craniodorsal thorax, we've got the caudodorsal thorax in the top right, and then we've got the cranioventral thorax in the bottom left and the caudoventral thorax bottom right. If I'm being super critical of these images, I would like the craniodorsal thorax to be a little bit further cranial and the caudodorsal thorax to be a little bit further caudal. You can see we've got quite a lot of overlap for the carina here, and that would then allow me to see a little bit more. We've just missed a bit off the front here, and the very, very caudal aspect of the tip of the lungs there in the carina, so in the caudodorsal view. Ventrally, we want to be able to see the humerus, we want to be able to see this triangle of lung tissue cranial to the cardiac silhouette, and caudally we want to see the diaphragm here. So we're quite happy with the caudal images, but dorsally we could actually probably do with either moving these two a little bit further cranially or caudally, or actually moving this one further cranially, this one further caudally, and taking a mid-thorax view. If we just take a step back and look at the structures that we can see, we've got in our craniodorsal thorax, we can see the cardiac silhouette here, and this big white stripe that's going around and curving back is the aorta. Got just a bit of the vertebral column there, and you can see the vertebral column continuing just here. This is the aorta here. It becomes less visible the further caudally you go. You can see our trachea coming along here, carina, and then our pulmonary vessels that are spreading out from the carina here. And similarly, this is our cardiac silhouette. This is the sort of cranial mediastinum here, caudal border of the cardiac silhouette, which we can't see very well here, and we'll talk about why in a moment, and then our diaphragm. If we just focus on our caudodorsal view for a moment, we can see, if we look caudodorsally, we can see that we have our vertebral column. We can see that we've got some lung tissue here, and I would say that's relatively normal lung tissue. So for a horse, we would normally expect a mild degree of a bronchiointerstitial pattern because of the sheer volume of lung tissue we have. We can make out the vessels, but they're not very clear. They're a little bit blurred, which is where we get our interstitial pattern from. And then we've got some peribronchial cuffing here, which is perfectly normal in the horse, and I wouldn't be too concerned about that. As we move further ventrally though, and caudal ventrally, we can see that we've got this ill-defined region of fairly opaque tissue just caudal to the carina. It's not at the level of the cardiac silhouette. The cardiac silhouette's further forward, so this is within the lung tissue, we think. It's very fluffy, obscures all of our normal blood vessels, and we can actually see we've got a semicircle of gas here with a horizontal line and another one here, and you can see that we've got a rim here which almost looks like a wall. So we've got some increased opacity throughout this area here, and we've got some well-defined gas lesions with a fluid line, which would sort of scream cavitatory lesion to me. We've got 2 there, and there's potentially one a little bit further caudally, but it's not as clearly defined. So that's occupying most of the sort of mid-caudal thorax, and it extends. If we look at our caudoventral view, we can see it extending down into the V formed by the cardiac silhouette and the diaphragm. Our cranio-ventral tissue seems okay, our craniodorsal tissue seems okay, so it's fairly located just in this caudoventral region. If we think about what could cause that, so that's a fairly classic appearance for a pneumonia or bronchopneumonia in a horse. It's a fairly classic location. The cavitatory lesions here would then most likely to be abscessation, and we can then make quite a nice story that this horse has a bronchopneumonia, which is what's causing her to cough, and we can also speculate about what our possible etiologies of that are. So our possible etiologies in an adult horse for a bronchopneumonia would include something like aspiration following a choke, or something like a travelling pneumonia. So horses aren't designed to have their head up for a long period of time. If they have their head up for a long period of time, such as when travelling, the upper airway excretions pool in the trachea, and you can get a colonisation of upper airway commensals into the lower airways, and that will lead to a pneumonia. We often get a pleural effusion with that type of pneumonia, and I can't see a clear pleural effusion here, and you'd look for that sort of in our ventral aspect of our thorax. I can't see that clearly in this case. However, it can sometimes be difficult to tell down here, so we often would recommend that these horses have an ultrasound as well of their thorax to detect any evidence of pleural effusion. I think that's everything for this case, so remember, it is your case, so please don't hesitate to ask any questions that you may have on social media, and do let us know whether or not you enjoyed the cases. So thank you very much for listening. We'll see you again soon with some more equine cases. Until then, take care.